Hello, this is Radhukeshini and here we are going to discuss about the skull anatomy. Bones of the skull, sutures and tricks to remember the bone's name. Before knowing those bones, we are going to know meninges, layers of cranium, meningeal layers. First is scalp layer, so from out to inward. Okay, first is scalp and next is skull and next to that is dura mater. Dura mater, arachnoid matter and pia mater. Three membrane, three layer, DAP. Remember it as DAP, DAP, from out to in. And from in to out, PAD, pad, PAD. There are two types of dura mater, that is periosteal dura mater and meningeal dura mater, which is connected to the arachnoid matter. And inside we have this pia mater, which is red in color. Red color, this one is pia mater, and deep to that is cerebral cortex. Between the arachnoid matter and pia mater is subarachnoid space. Space between arachnoid matter and pia mater is subarachnoid space. This is about meninges, layers of meninges, and next to that is anterior view of the skull, anterior view of the skull bones. And the first bone is frontal bone, which covers the forehead. Here is the frontal bone in this diagram. Frontal bone covers the forehead as well as the first half of the cranium. Remembering this word is by some trick, which is front view. Front view, this is the front view, so this is frontal bone. First bone is frontal bone and it's easy to remember. Next is, we shall go to maxilla. Okay, here is maxilla. First is frontal bone and next is maxilla here. So here is teeth and in upper jaw we have maxilla. This cheek is covered by maxilla, and remembering maxilla is first max, divide it, separate this word max. Maximum cover, maximum part of the cheek is covered by maxilla. Maximum surface is covered by maxilla. It's just a trick, not a meaning. So maxilla is remembered as maximum cheek surface is covered by maxilla. This is the second bone, and next to that is zygomatic. Here, these two are zygomatic. Third bone, xy. Firstly, we have to divide the words. Divide it. Xy. Xy means, xy similar to shy, shyness, the expression we give. Shyness is given here, a blush formed, shy. Have a smile and we have a shy expression at this area. So this is called zygomatic bone, which denotes shyness. By shyness we can remember zygomatic bone. That is about third bone. And next is fourth bone, mandible. Here is mandible. The lower jaw, this is mandible. So first what we have to do is separate it. Man, M-A-N, man, then dibble. Man has a sharp angle over the lower jaw. So this area is mandible. So fourth is mandible. It's remembered as man, lower jaw is sharp. So that is mandible. And next is temporal bone. Number 5 is temporal bone. Here, above the ear, two side, here and here. Two side we have temporal bone. Temporal bone is also very easy to remember, and temporal bone, that word is similar to temple. Am I correct? Temporal, temple. In temple, before Ganapati, in front of Ganapati, we used to do this. Okay, so this is done in the temple before, in front of the Ganapati. So temporal bone is above the ear. The part can be easily remembered. Number 5, fifth temporal bone, that's over. And number 6 is parietal bone. Parietal bone is above temporal bone. Pari tells to temple god. Pari tells to temple god. Parietal is parietal. Parietal, divided. Parietal to temple god. So that is above the temporal bone. And that is 6th bone. And the 7th is number 7, sphenoid bone. Sphenoid bone is here. This is sphenoid bone, which is similar to butterfly. It is butterfly in shape. So Spain butterfly. Remember sphenoid bone as Spain butterfly. That is the 7th bone. And next is omer. This is nasal cavity. This is nasal cavity. This is nasal area Here at the bottom we have omer bone. Omer, divide this word, sorry, here VOM, om, om. From where we make that sound is at the tip of the nose, om. Am I correct? So from here that sound come, om sound. That's why here is the omer bone. That is, here is the omer bone. And this is nasal bone. This is nasal bone. Nasal refers to nose. This is nasal bone. And next is lacrimal bone, which is inside the orbit. Inside the orbit, here is lacrimal bone. Okay, lacrimal bone. Lacrimal fluid comes through the orbit. That is, tears comes through the orbit. So that is lacrimal bone. And above that is palatine bone. Above that is palatine bone. A tiny bone. Okay, which is above lacrimal. That is palatine bone. And that's all about the anterior view skull bones. Let's continue the posterior view of skull. Skull anatomy, in which posterior view. Posterior view, first of all, we shall know the suture names. Sagittal suture, number 1, sagittal suture, and number 2, here is the lambdoid suture. Okay, 2 sutures which is present in the posterior view. So remembering those words, those suture words is first lambdoid suture, lambda. This is the shape of lambda. So see, at posteriorly, which is from the back side, this is the lambda shape. So this is lambdoid suture. And sagittal suture, divide it, sag. First divide the word, we can get SAG, sag. Sag, sagging which occurs at the middle. So if this is a flat surface, and here is the sagging, okay, which occurs in the middle. So mid of the cranium, this suture is sagittal suture. Sagittal suture separates 2 parietal bone. I told you here is the parietal bone, which is above the temporal bone. So these 2 parietal bone is divided by sagittal suture, and lambdoid suture, which divides parietal bone from occipital bone. Okay, occipital bone and parietal bone is divided by lambdoid suture. Okay, this is about 2 sutures which is from the posterior view. And occipital bone, occipital, divide that word, we will get ox. Occipital, ox. Ox hit at the back. Ox hit at the back of head. So occipital, which is in the behind your head here. Okay, so this is occipital bone. And here is mastoid process in the temporal bone. Temporal bone we already saw it in anterior view. Okay, here is the, which is above this ear, here is the temporal bone. And above temporal bone is the parietal bone. Pari tells to the temple god. Pari tells to the temple god. It's okay? Is that okay? So pari tells to the temple god. Temporal bone, above that is the parietal bone. And in temporal bone there is a main structure which is called mastoid process. Mastoid process, this. So behind ear, here is the mastoid process. The prominent one, you can feel, touch. Just try it. So here the prominent bone which you can feel behind the ear is the mastoid process. Mastoid process. So remembering mastoid process, first divide this. Mask. As mask, as we have temple, for Muslims it's mask. So mask, in mask they used to do this. For their prayer they used to do this. Have you seen it? Okay, so which is done behind the ear. So this is done in the mask. So this is mastoid process. That is about posterior view. And let's get into the lateral view. Most of the bones already we are familiar. It's just a glance. We shall know it from lateral view. Okay. So this is frontal bone, and here is the parietal bone. Frontal bone, and here is the parietal bone. Firstly, lateral surface. Lateral view is this side. So first anterior view. Firstly we saw anterior view, and next is posterior view, which is from the back. This is posterior view, and lateral view, it's this, a side view is lateral view. So it's a side view of the skull, which is lateral view. And here is the, this above this is the temporal bone. temporal bone, and above that is the parietal bone, and front here is the frontal bone. So this is the frontal bone. Okay, and here is the mandible, jaw angle, sharp jaw angle. So here is the mandible, and here posteriorly we have occipital bone. Here is the zygomatic bone, shy expression, and maximum area of the cheek is covered by maxillary bone. And here is the nasal bone, which is nose. Here is the nasal bone. And what we need to learn here new is it's two sutures. Okay, 1 and 2 here. Third, coronal suture, and this is squamous suture. Okay, two new sutures here we have to know. Coronal suture, coronal. Okay, so that's crown. Coronal mean crown. That is familiarly known as crown. Okay, so crown is kept here. So this area. Okay, so coronal suture divides frontal bone as well as parietal bone. Crown for king or queen is kept here, right? So this area is the coronal suture, and squamous suture is here. Squamous suture divides parietal bone from the temporal bone. Here is a story. Pari tells to temple squad. Which is parietal, tells to temple squad. Temple is temporal and squad is for squamous suture. SS means squamous suture. SS means squamous suture. Here is the squamous suture. So squad for squamous suture. That's all about bones of the skull and suture. And that's the end of the video. Thank you so much. Thank you for your patience. And do like, share and subscribe. Plus comment your opinion. Both positives plus negatives. Thank you. See you on another video. Bye bye.